Kia ora anō tātou. So I'm just going to introduce our next presenter. Before I start, just letting you know that this is a pre-recorded presentation, and so there won't be any questions, Q&As for this one. So, but I will read his bio. So this is Howard Catton, and he is CEO for International Council of Nurses, actually just from last year's 2019, September. So his presentation is titled Global Health 2020, a time of both huge challenge and opportunity for nurses and nursing. Howard was appointed Chief Executive Officer of the International Council of Nurses, ICN, in February 2019. Under his leadership, ICN is seeking to maximise the opportunities presented by the 2020 International Year of the Nurses and Midwife and build on its legacy. He is committed to ensuring that nurses have a seat at the highest level of decision-making for the benefit of the profession and global healthcare. Howard joined ICN in April 2016 as the Director, Nursing Policy and Programs. His team led the development of ICN policy and position statements, working closely with the World Health Organization and other international organizations to provide nursing advice on global health challenges and input into format WHO and UN decision-making meetings and processes. He also coordinates ICN programs and projects, including leadership development, and work closely with non-government health organizations, civil society and private sector organizations. Howard also oversaw the development of scientific programs for ICN events, including its World Congress held every 2 years. In December 2019, the Royal College of Surgeons in Ireland appointed Howard as Fellow of the Faculty of Nursing and Midwifery. The fellowship without examination is granted in exceptional circumstances to nurses who have rendered outstanding services to the profession. So on that note, I'll just introduce you to Howard Catton, CEO for ICN. Kia ora tātou.
Kia ora NZNO, kia ora nurses of New Zealand. My name is Howard Catton. I'm the CEO of ICN, and I'm delighted to be able to join your virtual conference. I'm bringing greetings from the ICN President, Annette Kennedy, and from the whole of the ICN board. And I would particularly like to thank and acknowledge the leadership of NZNO for their enormous support, not just over the years, but over recent weeks and months as well. Kerry, Memo, your senior elected officials and staff, thank you for all that you do to support ICN. For those of you who don't know, New Zealand and NZNO actually have a special place in my heart. I worked with NZNO back in the mid-1990s, was hugely supported, learnt an awful lot about nursing in your country, your people and your history, and I'm very appreciative for that. And I also, on a personal note, I proposed to my wife in New Zealand, and if you're interested, she said yes, and we're still together. So today I wanted to take a few minutes just to share with you some ICN reflections on these unprecedented times that we find ourselves in. Undoubtedly massive challenges that nurses' health systems around the world are facing, but I think there are also equally huge opportunities, and I want to share some thoughts and reflections on that with you. So I'm going to try and share my screen now and go into this presentation. I probably need to say very little about ICN. You know who we are. 130 national nursing associations. By the time you see this, we will have grown by another 2 associations, so watch out for news for that. Somewhere in the region of 27 million nurses now, right the way around the world. We were the first organisation to be recognised, the first NGO to be recognised by WHO. And NZNO were one of the really early founders of ICN. I think you joined in about 1912, so just a few years after the founding of ICN. The relationship with WHO, it doesn't just tick over year by year. We have a special collaboration plan which sets out what issues we are going to work on. And I think, and I hope you will have seen that the relationship with WHO is good, it's strong, it's mutual. Those of you who were with us in Singapore will have heard from Dr. Tedros, Elizabeth Ero, first chief nurse from your region of the world. And of course, one of the very practical things that WHO under Dr. Tedros's leadership did right at the start of his tenure as the Director General was to agree that 2020 would be the first ever designated global year of the nurse and the midwife. And on this slide, I think you can just see some of the reasons why WHO said we need to put nurses and midwives front and center of our work. If you look at and think about the big health challenges that the world is facing, the sustainable development goals, the fact that only half the people of the world have access to health care, we need to increase coverage and access to health care, the big public health challenges we face, NCDs and infectious diseases, some of the humanitarian disasters that happen regularly now, and also the fact that we want to change our health systems to put people right at the center of them, to organize them around people's needs rather than those of health systems. And of course, the importance of growing, investing, scaling up our health workforce. When you look at this list of global health challenges that WHO were looking at in 2018, 2019, we see nursing work. And that translates into their general program of work to improve the number of people who are healthy, to support people and protect them in health emergencies, and to improve coverage. So nursing and midwifery is seen very much at the heart of the WHO agenda, agreeing to have a year where we would raise the profile of nursing, we would make the case for an investment in nursing, we would try and bust some of the traditional myths and images about nursing, and we would reset some of our health systems so that nurses took a much more central leadership role. And this is what we were looking at in December and our planning, in December 2019, our planning for 2020. And of course, January 2020 arrived, and so did COVID-19. And without a doubt, it's made this year very, very different to the one that we were planning. It's not a year that we wanted. COVID, of course, isn't something that we wanted, but here's my observation, and I'm going to be completely upfront with this now. What COVID is showing to the world is probably more powerfully delivering on the objectives of having a year of the nurse and the midwives than it would have been without COVID. And what do I mean by that? People around the world are seeing the reality of modern day nursing. Yes, they're seeing caring, but they're seeing courage, they're seeing complexity, they're seeing leadership. They are really getting the value of investing in health systems, not as a nice to have, but how intimately related healthcare is to our economic well-being, our abilities to go for a walk in the park to see the grandkids and our relatives as well. And as I said, whilst none of us would have wished this, this does, I think, create an opportunity for nursing to be seen in a different way, but for us to take a much more prominent role in how health systems are organised, how nurses lead healthcare delivery, and how we value our nursing workforce as well. And I'm going to give you some more reflections on that as well. Because ICN is a global affiliation of 130 plus national nursing associations, one of the things that enabled us to do right at the start of the pandemic was to follow its spread around the world. In March, we were in close contact with colleagues in Asia as the pandemic moved across to Europe, then to the Americas as well. We were able to take the learning, the experience to share that. What you're looking at now is the most recent heat map that I have of coronavirus, and you'll know in Brazil, in Mexico, in India, particular very high numbers of cases at the moment, but also resurgences in Europe and other countries as well, and the reintroduction of some lockdown measures. Our affiliation, our solidarity, our work globally has enabled us to have a very prominent voice, not just in tracking the progress of coronavirus, but also identifying where there are weaknesses and areas that need to be improved, but also learning which is to the benefit of all of us. And one of the things that we did very early on at ICN, you go on the front page of the website, click on the portal, the COVID portal, and it will take you to this page. You can access the transcripts from webinars that we've had, links to good practice guidance and case studies from national nursing associations. We've been working incredibly closely with WHO, guidance in relation to IPC, health worker safety as well. All of those resources are available to you and to our associations through the portal on the website. And as quickly as we could in May, we also published the ICN Call to Action, a 12-point plan of what we believe the most important priorities were that countries and health systems, political and health system leaders should be focusing on. You can see that 12-point plan here. Again, particular shout out to NZNO, whose support, whose feedback, whose advice was hugely helpful in terms of putting this together. And you can see what we said in May. I'm not going to run through all of these, but the protection of health workers, nurses and health workers, the supply of PPE, physical and mental health well-being, financial protection, ensuring safe staffing levels, capitalizing on nurse leadership, learning the lessons, central issues to the call to action. And this 12-point plan has been guiding very, very much of the work that we've been doing here at ICN and with our associations. And I want to say a little bit more just about some of the particular aspects of the work that we have been focusing on. What became very clear to us right from the start of the pandemic, the discussions we were having with nursing leaders in our associations, was that there was a problem with supply of PPE. There was either inadequate supply, it was not being distributed correctly, or the quality of PPE was a problem. And we were hearing reports about infections amongst healthcare workers. So ICN from March, April had started to collect data on infection amongst healthcare workers. What you're looking at is, when you see this, it will be out of date, but I will talk you through this because I think the numbers are still really significant and will have gone up. I know they will have gone up from the ones that I'm going to share with you. The red line shows you the number of COVID cases globally. This was 16 million when it was put together. I've been on holiday, I've come back. I know it's now around 20 million. When you see it, that line will have gone up. I suspect it will probably be up towards 25 million. The work that we did with National Nursing Association showed us that the level of healthcare worker infections in countries varied. There were some countries that had a very low level of healthcare worker infections, 1% of all infections in Singapore. Other countries reporting 30% plus. Spain and the Republic of Ireland, particular high levels. When ICN looked at all of the data that we had from 35 or so of our associations in the worst affected country, we believe that the average is probably around 8%. 8% of all COVID infections are healthcare workers. Recent weeks, WHO have said it could be up to 10%, so we're in a similar ballpark. That being the case, if you then look at the blue line, that shows you what the level of healthcare worker COVID infections would be globally if it is 8 to 10% of all infections. So when it was 16 million cases globally, we were looking at 1.3 to 1.6 million healthcare worker infections around the world. If it's now 20 or even 25 million, that could be 2.5 million healthcare worker infections. And we know through country work as well that when you break down, not all countries do this, but when you're able to break down which healthcare workers are most severely affected, of course it's nurses who come out as one of, if not the highest group. And you can see numbers there from some countries that we've had in relation to Mexico, for example. And of course, obviously, but tragically, if that number of healthcare workers are becoming infected, some of them are and have passed away. Again, it's not something that ICN wants to do, but nobody else is collecting this data at the moment, and our colleagues are dying as a result of having contracted coronavirus, which we believe the failure to provide adequate PPE is a contributory factor. So it is absolutely vital that we highlight this issue and advocate very strongly on it. And we have been collecting data on the number of deaths of nurses from around the world. When we last reported on this back in June, the figure was that we were aware of was more than 600 nurses globally who had died from coronavirus. Colleagues, we will be doing an update on this very soon. It may be that there's a new information by the time you see this from me. I fear that we are likely to be surpassing the grim milestone of 1,000 nurse deaths. And the tragedy, and it's more than a tragedy, I've called it a scandal, is that despite us calling for the infection data and the data on deaths of nurses and healthcare workers to be collected in a standardized and systematic way, that has still not happening in a coordinated country by country basis. Some countries are doing it, but of course there are issues with different definitions that we have. Not all countries are. We're calling this not to blame people, not for data's sake, but we think that the data, the analysis, the science that would come from this information would help us to improve healthcare worker and of course nurses protection as well. And we will keep doing that, and we won't be shy about raising these concerns in the public domain. But I very, very much hope that the time comes soon where we don't have to do it. Just in the last couple of weeks, organisations Augustus Amnesty International has also published a report on this. They believe 3,000 healthcare workers have died around the world. Like us, they say they believe it's an underestimation. They quote and cite the ICN work. So we will continue to push very, very hard on this with other key organisations like Amnesty. This just gives you a timeline of some of the work that ICN has been doing since March. The calls we made on G20 leaders for better better supply of personal protective equipment. When we first called for the standardised collection of data on infection rates amongst healthcare workers, we included that in our statement to the Virtual World Health Assembly in May. We've continued to update the media in relation to those figures. But what we've also been doing in the last couple of months is highlighting as well the dreadful examples we've seen in some countries of physical, verbal attacks on healthcare workers, discrimination as well. Yes, it's fed by ignorance from people who think that nurses or other healthcare workers are disease spreaders, but it is no excuse. It's reprehensible, it's intolerable, and we have said no ifs, no buts. Government should be taking a zero tolerance approach to attacks, assaults, violence against health workers. And the other statement that we made, again, just in the last few weeks, is in relation to vaccinations. All of us, country leaders, health leaders, thinking about what's the exit strategy look like from coronavirus. Very, very difficult to imagine an exit strategy without a vaccine. That's going to be at the heart of it. But there are 17 billion of us on this planet. When we have a safe and effective vaccine, we're not all going to be able to have it at the same time. And that's why ICN said very clearly, very loudly, just a few weeks ago, that when we have a safe and effective vaccine, we believe that healthcare workers, nurses, should be prioritised for that vaccine. Very pleased to say, as I said, I just came back from holiday and looking and catching up on what WHO have said in the last few days. Just at the beginning of this week, this is now the end of August, Dr. Tedros has said that he also supports health workers being prioritised for a vaccine. But it's not just about a vaccine. You saw that in our call to action, we talked about fair compensation and remuneration for nurses as well. And the discussion about pay, about reward, has been part of our dialogue with our associations from the start of the pandemic. We have seen some countries who encouragingly and positively have increased pay awards to nurses. There's been a range of measures which have been used. In some countries there are bonus payments or allowances that have been used as well, but recognition of the work of nursing through pay and other financial rewards. But equally, we at ICN have seen examples of where pay deals have been reneged upon, employers, governments have failed to go into negotiations. ICN has had to write to presidents of countries to encourage them to negotiate, and we've seen some examples of strikes as well in Zimbabwe. I found out just in the aftermath of the terrible explosion in Beirut that nurses in Lebanon were about to go on strike literally a couple of days before the terrible explosion in the port of Beirut. So pay is absolutely an issue. Some countries are moving positively on that, others aren't, and those that aren't are seeing protests, demonstrations, and not just the threat, but the reality of industrial action as well. But let's be clear about this issue around pay as well. We're highlighting this at ICN also not because it should be considered as some sort of reward for dealing with coronavirus or some bonus or danger payment. What coronavirus is doing is highlighting the true value of nursing work to people, to societies, communities, economies. And the reality is, we all know, because of our history, our tradition, the gender issues that run deep through nursing as well, that our profession has been economically undervalued. valued. And coronavirus is exposing that and providing an opportunity to change that thinking. We are not a cost, we are an investment, and that's how we need to be treated and regarded in the future. And just in terms of how much interest there is in this issue as well, just before I went on holiday, I did an interview for Sky News, and it's on the slide there for you. I had one of those social media moments where I did the interview and I went on holiday, and 24 hours later thought, well, I'll just check my Twitter feed, and Sky News had put part of the interview out, and there were 60-odd thousand people in Europe who looked at that as well. So ICN is going to continue to be at the forefront of arguing for the world's nurses to have a pay rise that, as I said, isn't some sort of, oh, well, they deserve it because they've worked hard. It's part of, I think, what we see as a fundamental reset about how we value nurses and nursing work. We've done an awful lot of media over recent weeks and months on all of the issues that I've just talked to you about. I think it's really important that ICN, I know this is work that NZNO do brilliantly well, and other our associations do as well. But if you're going to say that you're the voice of nursing in the country, or you're the voice of the nursing globally, you have to be heard. We have something to say. We're a profession that's at the centre of this pandemic. We're a profession who needs to be directing and leading what comes after the pandemic, and we need to make sure that we're not just talking to ourselves, but we're talking to populations in our own countries and around the world. And our intention is to continue to do that work. I just wanted to share this with you as well, because whilst so much of what I've said has been around coronavirus, there's been some really important other resources that we've made sure have still come out this year from ICN. The International Nurses Day report on nursing the world to health, some fabulous case studies in that in terms of nursing practice, new guidance on advanced practice, our disaster competencies, a report on migration and mobility, and also the State of the World's Nursing Report. The State of the World's Nursing Report, you know, the first ever that we've had of this, it was released on World Health Day in May in collaboration between ICN, WHO, and Nursing Now as well. I would encourage you all to dig into it. There is some really important data in there. This is just one example from there, but it's the standout finding in terms of the level of shortage of nurses around the world, nearly 6 million, but it also highlights the massive inequity in distribution of nurses around the world. 5.3 million of that shortage is in low and middle income countries. You can also see how the density per 10,000 population varies enormously as well. We need to really invest in nursing education to scale up the supply line for the future. And the issues that I've talked about around pay are equally important to this scenario, because as whilst we need to scale up for the future, we need to hold on and retain the people that we've got. And there are a whole load of measures that you know as well as I do that are important to doing that. Pay is one of those things. As I said, I think that we've had some really good, strong support and a relationship with WHO in the run-up to 2020, and I'm pleased to say that that has continued through this year as well. If you look at the State of the World's Nursing Report, the 10 recommendations, strategic recommendations in that report were discussed extensively at the triad meetings, the chief nurse, the regulator, the NNA meetings that took place virtually in June this year. There was agreement, and the triad statement sets this out, that those recommendations, those strategic directions are our roadmap. Dr. Tedros has said that as well. He's made some very powerful statements about health workers being the backbone of health systems, only able to operate with one hand behind your back, with too few health workers. At ICN, I said very clearly, you know, if we don't have health workers, then the buildings, the clinics that we have are just, that's that's all that they are. They're empty buildings. They're empty clinics without health workers. And I know that WHO are committed to continuing with this focus on health workers. Just so that you know, the 17th of September is World Patient Safety Day. WHO have agreed to make the focus of World Patient Safety Day health worker safety as well as patient safety. Watch out for what we and ICN and WHO will be saying on that day as well. But I'm drawing to a close. I just wanted to say, because so much of our work focused on our current reality and COVID, but we know pandemics change the world. I've used the word reset quite a lot of times. And we're very conscious at ICN and through our conversation with associations that we need to be thinking and looking forward as much as we are dealing with the current reality. Taking the learning from COVID is one hugely important, because it's hugely important. But arguably the biggest threat, health threat that our planet faces is that of climate change. COVID has been happening, but we had at the beginning of the year, close to you, the bushfires in Australia, floods in Indonesia, hurricanes in the Caribbean, cold snap at Christmas in India. These climate-induced disasters are having profound impact on the health of people and our health systems. And I think it seems to us at ICN that as well as the learning from coronavirus, we need to think about climate change and how we develop sustainable health systems and bring that learning together to ensure that nursing has a clear view and voice in terms of what we want future health systems to look like. Yes, they need to be sustainable. I think there's a much greater role for nurse-led, advanced nurse practice and nurse-led services. We need to see much more prominent nursing leadership. We need to see the investment in the education, in pay, things that we've talked about as well. I think we're seeing nursing at the forefront of the use of technology. This is a narrative which is a very powerful and persuasive narrative, which again we need to develop and not be shy about taking forward for the future that we want. Year of the Nurse and the Midwife, because it's celebrating the anniversary of the birth of Florence Nightingale, of course. But I sometimes think that we don't talk enough about the founder of our association, Ethel Bedford Fenwick, enough. And this is, I think, my favourite quote from Ethel, one which isn't used or shared perhaps as widely as it should have been. And I like to bring it out because I think it is so powerful. But I also like to bring it out because I think often people have this image of us as being, a bit old-fashioned, a bit twee, a bit small c conservative. And Ethel said when she established ICN, by union alone can the necessary strength be found. And that was as important and powerful and pertinent when ICN was created in 1899 as it is in the first ever year of the nurse and the midwife, which coincides with the global pandemic that we are all facing. And it's not just us who are saying that union, cooperation and solidarity are absolutely integral to dealing with the reality we face now, but also our future. But we hear really important global leaders from WHO, from the UN as well, who make that call. Colleagues, I know we see nationalism in many countries, but I think that we as a profession, we as associations in country and through our international collaboration have a very strong, legitimate and powerful voice to call for multilateralism, solidarity for for our world, for our future. I think that's the case we're making now, and that's the case that we should continue to make over the coming weeks and months. Colleagues, thank you so much for your time. Thank you so much for all that you're doing for people within New Zealand. Thank you for all that you're doing to support the international community of nursing and ICN. I wish you a great conference, and I very, very much hope that I may be able to physically be with you at some point in the future, and we can perhaps then reflect on what we have been managed to achieve in terms of building future health systems as well. Take care, everyone. Bye-bye.
Anō reira, nā mihi ki aia a Howard o ona kōrero tika pono hoki ki a tātou katoa. Anō reira, kei te mihi ki aia. So many thanks to Howard and his the big mahi that he does and that they are doing. And I must say that I'm proud that NZNO is part of International Council of Nurses. So yeah, and to our leadership of NZNO, keep up the good work, because that's why we're there. So, nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa.